My safety record regarding refractive cataract surgery goes back to my early days as a training doctor in London, and I'll mention that in just a moment. But to answer the question more directly, there is a national benchmark safety record in the UK, which is published, and my own personal safety record is significantly better than that. The actual specific rates and the numbers are appropriate for the kind of risk that a specific individual's eyes entail, and I'm very happy to discuss those during the consultation. And patients do ask me, and should ask their surgeons, about specific risks and benefits related to their specific scenario rather than global national average. And so that specific information is more appropriately discussed in an individual consultation, because I can give more specific information regarding an individual's examination and clinical findings. But my overall safety record is significantly better than the national average. Returning to what I mentioned a second ago, back around 2002 to 2003, as a training doctor in London, I realised that there was no system in place to formally stratify patients having cataract surgery according to combined risk factors. There had been published papers in the past pertaining to individual specific risk factors, but there was nothing that had combined them all to give a global risk score. So I developed a risk stratification system and then validated that and published a large study back in 2004. And that system is used in various clinics in countries around the world. I use that system myself in my practice to assess an overall global risk score. That allows me then to give patients individualized risk versus benefit information, and it also allows for risks to be mitigated, so that when they're highlighted before the surgery, part of the surgical planning, aside from the kind of lens implant you're going to receive and astigmatism and multifocality, is planning to do with mitigation of certain individual risks for certain individual patients. And so all of that is part of the preoperative planning and part of the consultation discussion that I have with my patients. I invite you to contact my practice by calling the phone number provided. We can start the process of consulting and determining your suitability for the interventions that we can provide, and hopefully get you to a point where you're achieving your outcomes and enjoying life without cataract and without needing your glasses and contact lenses.